Victoria, Lindsay, welcome to the Tokyo Living podcast.
Thank you so much for having me.
Perhaps if you could just start off by giving the listeners and viewers a bit of background on yourself.
Sure. So I am a registered dietitian and have been practicing for about 10 years. I'm originally from the US, so that's where I did my dietetic education and training, and that's really where I started out my career. Within the past 10 years, I worked in a wide variety of settings. I've worked in pediatrics, I've worked in research and teaching at University of Texas at Austin. I even did a stint working for the US government for the President's Council on Fitness, Sports, and Nutrition. So really got to see nutrition from a lot of different angles with a lot of different populations. But I have to say, it's been really nice to be here in the clinic, here in Tokyo. I work at Tokyo Medical Surgical Clinic, and seeing patients face to face again, because I really did miss that. I like building that relationship and supporting them to make, positive changes in their life.
And what's your sort of typical caseload at Tokyo Medical in the sort of type of clinic you're in at the moment? What sort of patients are you seeing mostly?
Sure, all kinds. I see people, to answer it quickly, I see people looking for weight management. And then on the opposite side of the spectrum, I see a lot of people with eating disorders and disordered eating. That's an interest of mine. I see people for things like celiac disease, for working on medical nutrition therapy to help correct high cholesterol, high blood sugar, gestational diabetes, pregnancy nutrition. I work with some adolescents as well. So really just the full gamut.
Yeah, it's sort of what comes with being in a private practice with, I guess, similar to us in the physio that we do. We have to be there to be able to see everything, which is good. Yeah, it makes
it's
the job
great,
fun.
right? It's all interconnected. Someone may come to you for weight management, but then you do an assessment and analysis and you realize, oh, actually there's a lot of disordered eating going on and that needs to be addressed. So it's good to have, experience and knowledge in all of the different areas, because it all sort of intersects, doesn't it?
Yeah, for sure. For people who may not have worked with a dietitian before, I know we had Sarah McGregor on a previous episode quite a while ago before she left Japan, and she sort of gave us a bit of a background on what a dietitian is and maybe the differences between a dietitian and a nutritionist. But for you, what does your sort of practice look like, and why might someone need the help of a dietitian, especially someone who let's take a typical expat who is maybe relatively new to Japan? How may they sort of benefit from the services of someone like you?
Sure. Good question. So as a dietitian, I provide evidence-based nutrition counseling and medical nutrition therapy. And so what that usually entails is doing an assessment with the patient, doing some analysis with them, asking them some questions, looking at any data available like laboratory work, past medical history. Then from there, we look at dietary interventions and strategies, and it's really a collaborative process. It's not just me telling the patient, this is what you do. It's working with the patient, bouncing ideas off of each other, brainstorming. And from there, then we come up with some personalized and practical, it has to be practical, nutrition guidance for the patient to then implement for whatever they need, whatever their needs are. And one thing that people might be surprised that I don't do as a registered dietitian is give them a meal plan. A lot of people come in and that's what they want. They have it in their head that they need a meal plan. And they're like, just tell me what to do. Just give me a piece of paper, tell me what to do, and I'll do it. But I can't ethically give you a meal plan because I know that they don't work. They're really just a Band-Aid on a bigger problem. And I think the best way I can explain this, and this is what I explain this to patients, is like this. Like if you're learning Japanese and someone gives you a document and it has, a bunch of common words and phrases, well, that'll be helpful, a little bit, right? That'll teach you a few things, and you can say hello and goodbye and please and thank you, and you'll get some value out of that. But then what happens when you're in a situation where you need to ask a question, or you need to answer a question, or you ask a question, they say something and you're like, if you haven't learned vocabulary, if you haven't learned sentence structure or grammar, then you really can't communicate. You really can't speak Japanese, can you? The same thing can be said for meal plans. Meal plans don't actually teach you to be a competent eater. they just tell you what to do, and that is okay temporarily, but that's not sustainable. I mean, if you look at longtime healthy eaters, people that do really well with balance and nutrient density in their diet, like I guarantee you they're not going to a meal plan every, or to a dietitian every single week to get a meal plan.
Yeah.
So that is something that I think is good to raise awareness about. Like, these things are okay. It's good to have meal ideas, and we definitely do that in a session, but as far as a weekly meal plan, that's just not something that most dietitians are comfortable doing.
And when you talked to us before about assessments that you might do to guide the interventions, what's maybe an example or two of the type of assessments you do, and how you would use those to then sort of structure the interventions?
Sure. So a lot of it is just gathering history from the patient and really kind of exploring their relationship with food, asking questions about their eating behavior, eating patterns, even asking things like, how do you, prepare your meals? Who prepares the meals? Where do you shop at? All of those things give me some information as to the best, strategies that can support you. We also, if available, look at lab work. What are your laboratory values? What's your cholesterol? What's your glucose level? What's your hemoglobin A1C? And then we can also use that to then inform any kind of dietary intervention that we might use for you.
And I guess, are there any specific issues that you see people dealing with that are new to Japan, or new to Tokyo?
Yeah, great question. So I think a move can really exacerbate any existing problems. So I tend to see that a lot. Like, maybe people were struggling with their weight before the move, but then because of the process of the move, then that situation becomes unmanageable or out of control. And that's why they might need, some professional assistance in coming up with a solution for that.
Yeah.
Or maybe they're having some disordered eating, they're doing some, restricting or some binging behavior, but then again, due to the stress of the move, that condition exacerbates. But I also see a fair amount of people that are like, hey, I'm new here or new-ish here, and I just don't really feel like I have a good grip on meal planning, and I just need some ideas. Like, I know I'm not eating as healthfully as I can, and maybe it's showing up a little bit in my cholesterol, or maybe it's showing up a little bit in my weight, but I want to learn more information as to how I can eat healthfully here in this environment.
I wanted to move on now to talk about a little bit more of a specific topic in terms of intuitive eating. So I guess people may have heard this term thrown out there before, and there may be some sort of misconceptions about what it actually means. I'm sure it doesn't just mean eating what you want when you want. What actually is intuitive eating?
Good question. I think of intuitive eating, there are 10 principles, but I think of it really in two main parts. The first part is reconnecting with those inner hunger and fullness signals and listening to your body to eat when you're hungry, stop when you're about 80% full, to help you get the right amount of food for you and your body in order to promote good energy levels and health, which sounds really simple, but it's actually pretty hard to do in practice. A lot of us don't eat by listening to our body. We look at the clock, or we look at what someone else is eating, or what we think an appropriate portion size is, and that's what we use to guide us. I think the simplest way to explain it is we're all born intuitive eaters. I mean, you have children, right? You have 2 kids, 3 kids?
3 kids now, yeah.
And how old is the youngest one?
Just turned 1.
Oh, perfect. Okay, so you remember this really well then. So is it a son, right? Boys?
Yeah, 3 boys. Yeah.
Okay, so when your son was a newborn, you didn't teach your son, this is what you do when you get hungry. This is what you do when you get full. You didn't teach him what hunger or fullness was. He just cried when he was hungry, and he drank from a bottle or nursed. And then when he was full, he was full, right? You'd pull away. He'd had enough.
Yeah.
It is this instinct that nature provides for us as a way to regulate our intake. And unfortunately, even though we're all born intuitive eaters, we don't stay that way, right? We grow up, we hear different messages from people. Mom and dad tell us we have to clean our plate. We see people dieting and think, oh, maybe that's a good idea. And so over time, that relationship, that inner relationship with food is eroded because we start looking to external tools and methods in order to control our food intake. So that's kind of the first part. So then the second part is allowing yourself to eat all foods, to kind of making foods more neutral in a sense, you know, to stop with the labeling of foods as good or bad, and just give yourself permission to eat. And that really came as kind of a backlash to traditional diets that were very restrictive. We've all heard the research on traditional diets where, you know, most people who go on a diet and lose weight will not be able to keep it off in the long term, right? They regain the weight, and in some cases they regain even more weight than, you know, they started out with. And so, you know, part of this was just, you know, hey, we have all these foods in our environment. We have to learn to live with them. And so maybe restricting them is not the answer. Maybe the answer is actually, let's give ourselves permission to eat these and see what happens. And it sounds really scary to a lot of people at first, but, you know, by letting yourself have permission to eat and, you know, working more towards balance and stopping with the labeling of foods as good or bad, you know, those foods, they kind of, especially like the sweet foods or the foods that we might consider junk foods, right? They become, you know, not so exciting anymore. You take them off of the pedestal and you just find a way to then work them in your diet that honors your health, but still keeps you keeps you satisfied and happy.
Yeah, interesting. And so, how else is this sort of effective? What are the main sort of advantages of this type of eating?
So from a research perspective, there's now a growing body of research to support intuitive eating. I think when I was introduced to it in school, like the research was really just starting to develop, and now it's been pretty cool to see it become more robust. But we know that people that are intuitive eaters tend to have a lower BMI, and they tend to have, you know, per some studies, better markers of things like, you know, better HDL cholesterol levels, or lower triglyceride levels, etc. So there is some research support to say that, you know, this does make you physically more healthy when you embark on this type of eating pattern. Aside from it making you more more physically healthy, a lot of people will note that there are a lot of emotional and mental benefits to it. When you're on a restricted diet, that's all you're thinking about is being on a diet and then all the things that you can't have. But then when you liberalize the diet a bit and you know, take a lot of the stress and a lot of the morality out of the diet, suddenly eating becomes a lot more enjoyable again. And you're not in this state of stress and anxiety around food and food choice.
There, certain types of people or certain conditions that respond more favorably to this type of intervention.
Sure. I mean, there are parts of intuitive eating that I think are good for everyone, right? Like eating when you're hungry and only hungry, and then stopping when you're 80% full. I mean, right? That's a good, you know, practice for everyone, I think. But I think that the people who really resonate with intuitive eating are the people that have a pretty complicated or negative relationship with food. Intuitive eating is something we use a lot in eating disorder treatment. So sort of at the end of a patient's recovery, there's an introduction to intuitive eating as like, okay, this is how we're going to teach you to eat more normally now for the rest of your life, now that your weight restored or now that your binges have decreased. So definitely people with disordered eating or people that have a complicated relationship with food. I mean, I will say it doesn't resonate with everyone, and I think that's fine. You know, I think intuitive eating has a lot of benefits, and I recommend it a lot professionally. I also practice it personally, but you know, if it doesn't resonate with you, like the great thing about being a dietitian is I have a toolbox and there are lots of tools in it, and intuitive eating is only one of those things. I'm very uninterested in converting people to use intuitive eating if it doesn't work for them. I'm you know, not dogmatic about it. I think it's a great tool, and it's something that I don't think people know a lot about, or I don't think that they really understand it. But again, it's not the only thing, and that's okay.
I mean, without going into too much detail about how you would initiate this, but if you were to try this type of eating with someone, where would you start, and how would you sort of get them, especially if they are someone that has a bad relationship with food, where would you start to make steps towards getting to eat more in this way?
Well, I think a lot of it involves, for me anyways, I find better acceptance and adherence to it if you really take time to answer all of people's questions and go over like common misconceptions. So I think probably the biggest misconception I hear is, okay, if there are no food rules, okay, and all of a sudden I'm just supposed to listen to my body and eat whatever I think that I want. All I'm going to eat is pizza and cookies all day. Like, I'm not going to eat healthy food. And to that I say, well, you're not really listening to your body if all you're eating for breakfast, lunch, and dinner are cookies or pizza.
Yeah,
I
right.
mean, think about if you've had a big meal of any of those things, like your body doesn't feel great. You're tired, you're sluggish, you maybe have some, gas or bloating or digestion issues. Like, that's not tuned into your body. That's not what your body wants. You may think that that's what your body wants because when we tend to restrict things, we tend to think about those things, right? All of a sudden, those things are more valuable and more enticing. If we tell ourselves, I can't have it, I can't think about it, then suddenly that's all we think about. I mean, if I tell you, don't think of a white bear, what did you just think of, right? A white bear, just because I told you not to. It's just how human brains work.
Yeah.
So I think explaining that to a patient is really helpful. Answering all their questions as they come up and just, telling them, this is kind of what you think might be happening, but actually this is what the evidence says, or, this is how it kind of plays out in practice. And then really the first step of intuitive eating is giving yourself unconditional permission to eat. And this is really scary for some people. Some people have the opposite reaction though. They start crying tears of relief. It is not uncommon for people who have complicated relationships to food to actually be, crying tears of happiness in a session with me because they're just so thrilled that the answer is not putting them on another diet and for them to be demoralized because they're on another diet. They're like, this sounds more positive. Yes, I can do this. I have unconditional permission to eat. It's okay for me to eat, and it's okay for me to eat these foods. I just need to tune into my body and just have a more positive relationship with food.
I guess just sort of approaching this from a fitness perspective, if someone has, I guess, more specific body composition goals, let's say they're not necessarily overweight, but they want to get a little leaner, and maybe they have a slightly lower sort of resting metabolic rate, and particularly if it's a person that personality-wise knows that if they have that permission to eat things that are perhaps a lot more calorie dense than is what sort of optimal for them for that body composition goal, how might you work that intuitive eating into that sort of scenario? Or for those people, is it not quite as effective? How would you sort of work that type of case?
So when I was working at University of Texas at Austin, we had a research lab with DEXA body composition, machines. So I did a lot of scans of both people in the research study, but then also people from the general public could come in and get scanned. And so I worked with a lot of bodybuilders and like bikini competitors, because those people have, their nutrition and their body composition like dialed in, right? Because they're working towards a competition. I also saw like power lifters and different types of athletes. And those people are just a different population because you're training for something specific. You have very specific goals. Your macros are really dialed in. Your calories are really dialed in. That's not appropriate for intuitive eating.
Sure.
But somebody else that's more similar to the person that you described, again, I would challenge that thought that they're going to go off the rails if they're given unconditional permission to eat. Because I think we have to live in the world that we live in. Like, we have a wide variety of hyper palatable foods available to us at all times. Like, I wish the answer was to just not eat them. But look, it's too easy to, right? There are, you walk 5 feet in Tokyo and there's another combini or a vending machine, or you can get things on Uber Eats. Like, I just don't think a realistic answer is to completely abstain from those all the time because they're around all the time. And, like, willpower is like a muscle and it fatigues, it will give out. I think, the research says that we make an average of over 200 food-related decisions each day. And so if you're constantly telling yourself, I can't have this, I can't have this, I can't have this, like, again, like there's just too many choices for you to kind of have that breakdown and have it anyway. So, again, intuitive eating wouldn't be the only answer for this person. It wouldn't be the only tool that we might work with, but I would really, work with them and challenge them and say like, okay, well, how do we get you to a point where you don't feel out of control or you don't feel scared around these foods, where you can eat some and you can move on? Because it can happen. And again, we're born to be like this. Like my daughter is a great example. She's 2 years old, and really little kids are usually still pretty good intuitive eaters. I mean, I'll watch her eat and she will sometimes leave food on her plate that I know she really enjoys because
Yeah.
she's just had enough and she's over it and she doesn't overthink it.
Yeah.
Like, okay, well, there's another meal, another snack, and oh, look, that toy, and she's off, right?
Yeah.
Like, wouldn't it be great if we could reconnect to some of that and learn some of that behavior again and just take the morality out of food and just see food for what it is? It's food, it's here.
Yeah. Yeah. No, very cool. One point you sort of touched on earlier was trying to eat to the point where you're maybe 80% full. I'm sure to different people that the ability to gauge, obviously, it's not that's just a rough measure, but to actually be able to gauge that proximity to fullness, does that sort of take training? Do you have to? I'd imagine, for some people, their idea of fullness is just is a little bit unacquainted. And how do you go about sort of setting that up?
So something that we do in the sessions is work with using a hunger scale, rating your hunger on a scale from like 1 to 10. And then, talking about, okay, we really want to stay between like a 3 and a 7. You don't want to get too ravenous, because when you're too hungry, then you're going to make poor food decisions, right? But you also, want to stay at about a 7 or an 8, really. And you don't want to get too full, because when you're too full, you're going to feel tired. You're going to feel sluggish. I mean, we know when we eat too large a volume of food, we feel tired due to blood flow diversion, right? The blood goes from our brain into our gut to aid in digestion, and you feel physically tired. Like, we don't want that. So, we talk about physical signs of hunger. What does that feel like to you? And we kind of go through the different parts of the hunger scale and help people kind of adjust to that. But some people, for whatever reason, maybe they have some thyroid issues, maybe they have some other endocrine or metabolic issues going on, do have a much harder time doing that. And so again, it's kind of, for me as a dietitian, looking at, are they at a good place where they're able to do that, or are they not? Some people, when they're really stressed out, they have a hard time being able to tune into that. And so again, maybe then the first step is doing some self-care and managing your stress. And when that's better handled, then we can go back to kind of the intuitive eating and the hunger scale stuff. But a really good way to start out and work on this is to just slow down your meals. Not always feasible and practical. Sometimes I have to eat super fast because I have another patient coming in, or I have to go, pick up my daughter or do whatever. But slowing down your meals or using your non-dominant hand is a great way to just really slow down. And usually the slower you eat, the better able you are to be able to kind of tune into, am I hungry? Am I full? Where am I on that hunger scale?
Yeah, no, absolutely. That's a great tip. I guess just sort of starting to wrap up. I mean, if they have heard of this type of eating, and they've had to listen to this, and they think that it may be something they've sort of, I guess they've succumbed to the common misconceptions you described before, and sort of not really thought seriously about it, but they've taken in the information that you've given us today, and maybe think that it's a good thing for them. How might they get started? Obviously, go and see you would be a good place to start.
Sure,
But
sure.
is there any other sort of advice or any other points that you want to touch on if people are sort of thinking about going in this direction?
There are a lot of resources out there. Intuitive eating is kind of, it's becoming a little trendier. A lot of celebrities have spoken out about it. Jennifer Lawrence, I think, just mentioned in an interview that she practices intuitive eating. Some other celebrities have also been more vocal about it. So, I mean, a quick Google search will get you in the right direction. I mean, there's obviously, several books. They're a little bit more maybe not easy reading, I would say, kind of more academic, but there's an intuitive eating workbook by Elise Resch and Evelyn Tribole. That's great if you Google intuitive eating workbook. It'll come out, and I believe you can even get it shipped. Like the actual workbook can be shipped to Japan, and that's kind of nice because it's very simple, kind of breaks down the steps for you. But I mean, I've seen it trending on TikTok. I know it's like pretty popular in some Instagram accounts. So, you know, whatever kind of resonates with you, just go to that platform and give it a search, and you'll definitely, you know, be able to learn more about it.
Terrific. And as we said at the top, you're practicing at Tokyo Medical and Surgical. Do you have a website at all, or are you active on social media at all?
I'm somewhat active on social media. I have such a complicated relationship with social media because
We all do.
it is fun, but I try not to be on my phone. I try to be present, right? It's that battle. But I do post, you know, little random things on there from time to time. So I'm on Instagram at Dietitian in Tokyo. I do have a website, victorialindsay.rd.com. But yeah, if you are interested in a session on either intuitive eating or on any of the other things we talked about, you know, feel free to reach out. I just find that here with a lot of my patients in Tokyo, again, I talked about having a toolbox with a lot of tools, and I find that I just keep getting into the toolbox and bringing this out a lot lately.
Yeah.
And I think part of that is that for expats, you know, in your home country, you used probably a lot of external methods and tools to help guide your food intake. You could read a food label and like make a choice based on that, or you could read the ingredient list and find out if, you know, maybe this was something that you thought was good or bad or healthy or not, and then make choices that way. Maybe there were different eating habits or styles in your home country, but then you come here and all of a sudden you can't read the food label anymore. Even if you could, you don't know what the ingredients are, and the serving sizes are different, and the portion sizes and the dishes are different. And so again, I think, you know, that's where intuitive eating is really good and can really come into play and help people out in this time of a lot of change and stress and anxiety, and kind of provide and foster a more, you know, positive relationship with food here.
Fantastic. That's a great place to wrap up. Thank you very much for your time today. I think we'll get you on hopefully fairly soon to talk about some other topics. If listeners and viewers have some topics that you'd like Victoria to speak about, then let us know. But yeah, thank you very much for your time today, and yeah, we'll look forward to speaking to you again soon.
Awesome. Thank you so much.
All right. Thanks, Victoria.
Take care.
Bye.